This is the tracing of a patient with ischemic cardiomyopathy implanted with a dual lead ICD and hospitalized because he had received several shocks in the absence of symptoms. This is an old device. This is a Virtuoso DR. Uh, the aim of the tracing is to explain the need to extend the initial count to 30 out of 40 in the VF zone to reduce the risk of inappropriate therapies. The plot is really characteristic of a ventricular lead dysfunction with highly irregular ventricular rhythm with some short cycles at the level of the blanking and some intervals detected outside of the tachycardia zone. So this is a typical aspect of cloud of points suggesting uh, the presence of a lead dysfunction. We can see here that for this episode, the patient has received 3 maximal shocks. If you look at the EGM, you can see the oversensing in the ventricular channel of anarchic, very fast, and non-physiological signals. In this patient, there was a problem in the insulation of the ventricular leads with oversensing of pectoral myopotential. The oversensing is intermittent with long cycles and also fast cycles. And you can easily understand that if the initial count for VF is short, for example 12 out of 16 for this patient, the risk for detection of a false episode of VF is increased. This kind of problem, which was quite frequent a few years ago, has favored the programming of 30 out of 40 for the initial count in the VF zone to reduce the risk of inappropriate therapy in case of lead dysfunction without delaying too much the delivery of the shock in case of occurrence of a real ventricular fibrillation.